Hello, everyone. This is Janet Hill with the Rock Island County Health Department. Thank you for joining us. It is 3:30 p.m. on November 17th. Today, we have with us Ed Rivers, the Director of the Scott County Health Department, and Nita Ludwig, the Administrator of the Rock Island County Health Department. As always, please put your questions in the chat box, and we will answer them at the end of their prepared statements. Thank you. Nita, let's go ahead and start off with Rock Island County members.
Good afternoon. Today in Rock Island County, we have 145 new COVID-19 cases to report, and that brings our total now to 7,023. 72 patients are currently hospitalized in Rock Island County, and that is a new record for hospitalizations on our side of the river. And our deaths do remain at 117 today. Thank you.
In Scott County, the Iowa Department of Public Health reports 8,886 cases, and our deaths are at 61. We've seen an explosion of cases over the last week or so that has both our departments quite concerned. In Scott County, case counts have been averaging almost 300 a day, with some days being over 400 cases. By comparison, there are only 321 cases in the entire month of June. The Scott County 14-day positivity rate is above 25%, and Rock Island County's 7-day positivity rate's over 15%. This just speaks to the high level of spread we're seeing. Our medical facilities are sounding the alarm. They're reporting that it's been necessary to open new wards for the influx of COVID patients. At the same time, hospital staff have been sidelined by illness and quarantine. There's concern that soon they won't be able to accommodate patients in need. Yesterday, Iowa Governor Kim Reynolds announced enhanced public health measures to help address the explosion of cases and the healthcare system stress that we're experiencing across the state. In short, masks are required in indoor spaces open to the public. Social, community, business, and leisure activities are limited to 15 people indoors and 30 people outdoors. And this includes funeral and wedding receptions as well as family gatherings. Sporting and recreational events outside of high school, college, or professional sports are prohibited. Bars and restaurants must close by 10 p.m. Masks are required when not seated, and social distancing in group sizes of 8 must be adhered to. These measures mirror the requirements for other establishments such as bowling alleys and pool hall. Group fitness activities are prohibited, and last, non-essential and elective surgeries must be reduced to at least 50% in order to accommodate COVID and other healthcare intensive illnesses. We applaud these measures as a good start to helping reduce the spread that's causing our recent tsunami of cases. We know that people are spreading the virus to family members and close friends, and our investigators are told of gatherings without social distancing and masking. These numbers are what we'd expect to see when people aren't taking the necessary precautions to prevent the spread of the disease. The surge of cases is also dramatically impacting public health's ability to investigate cases in a timely manner. In Scott County, individuals testing positive for COVID-19 can expect to receive a phone call from either the Iowa Department of Public Health or our department. We had to make the difficult decision to transition primary responsibility for contact tracing and case interviews to the Iowa Department of Public Health. IDPH is currently providing contact tracing services for more than half of Iowa counties, and beginning this week is doing the same for Scott County. IDPH has greater resources to ramp up contact tracing services as they continue to soar higher each week. While we will continue to be involved in some level of contact tracing in Scott County, this transition will allow our department the ability to focus on our role in supporting our school districts, long-term care facilities, and other types of COVID-19 response, as well as upcoming vaccination planning. Know that individuals testing positive for COVID-19 in Scott County will still be contacted to be interviewed and provided guidance to reducing the spread of the virus. These calls will just primarily come from one of our two departments. Before I continue, I'm going to give Nita a moment to update you on all contact tracing in Rock Island County.
In Rock Island County, the health department will continue to be the entity that conducts contact tracing for Rock Island County residents. However, you can only imagine with the increase in cases that we have seen, sometimes more than 200 a day, doing that with our positive cases and identifying contacts in a timely manner becomes very difficult. We are doing our best in our department and all hands are on deck. Our contact tracers are working very diligently, but sometimes it isn't enough for the amount of cases we have right now. But we will reach out to everyone that is a positive case.
With that in mind, I'd like to take a moment to acknowledge the dedicated health department staff of both counties. They've worked tirelessly 7 days a week since early April to help protect our community, but they're weary. They're affected by the intense emotions that come with talking to people who are ill and scared, family members of those who are hospitalized, and those of the 61 members of the Scott County community who we've lost. They went into the career of public health to protect population health, but none of us have ever experienced a pandemic like this. What concerns us most right now is holiday gatherings. People sitting around a table, elbow to elbow, passing plates and bowls, talking, laughing, and hugging when they arrive and depart. We worry that these gatherings will mean further spread of COVID-19, especially to the more vulnerable groups like the elderly and people with underlying conditions. In our COVID-19 world, more cases leads to more hospitalizations, more stress on our hospital resources, and unfortunately more deaths, and we can't afford any of these things. We'd like to share our guidance for the upcoming holidays. It won't be warm and fuzzy, and you're probably not going to like it, but we'll continue to push for what we know will protect our community.
In this dangerous point in the pandemic, we are asking you to spend Thanksgiving and the upcoming holidays with family members in your own household. Adding individuals from different households as well as members of vulnerable groups to holiday celebration seriously increases the risk of spreading the virus around the table. Travel increases your chances of getting or spreading COVID-19. Staying home is really the best way to protect yourself and others from COVID-19. We encourage you to avoid travel as much as possible, especially during the busy travel season. If you do travel, please follow these tips. Plan ahead for things such as spread in the destination location and how to get to and from the airport, hotel check-in practices, and car travel routes. Avoid gathering in crowded areas such as airport terminals and hotel lounges. Wear your mask when on an airplane, in any common areas, and when in restaurants and or rest areas. If you make the decision to host holiday gatherings, keep them small. The Quad Cities' own Dr. Ludwig believes that groups larger than 10 significantly increases the risk of spreading the virus at this time. Remind guests to stay home if they feel sick or they've been exposed to anyone with COVID-19 or have symptoms of COVID-19 over the past 14 days. Arrange tables and chairs to allow for social distancing. People from the same household can be put in groups together and do not need to be 6 feet apart, just 6 feet away from other families. Skip the hugs, require masks, and provide them for those who might forget them. If you're serving food, have one person serve all the food so that multiple people aren't handling the serving utensils. When possible, use single-use options or identify one person to serve shareable items like salad dressings, food containers, and condiments so that multiple people are not handling those items. Consider using disposable plates, silverware, napkins, etc. to reduce the need to handle and clean them. If you make the decision to attend the gathering, please do so carefully. Stay home if you are diagnosed with COVID-19 or show symptoms. You are waiting for the if you're waiting for the COVID-19 results, and you may have been exposed to someone with COVID-19, also stay home. Bring supplies to help you and others stay healthy, such as a mask and hand sanitizer. Sit with those individuals from your own household. Wash your hands with soap and water for at least 20 seconds, or use hand sanitizer immediately before eating food or touching any common surfaces like hand railings, door handles, and toilets. The holidays are going to look different this year, as they should. We are in an active pandemic. Be smart during this time of year. Don't let a 10-plus day isolation or 14-day plus quarantine creep up and sideline you. As I said earlier, I also acknowledge and thank the managers and staff of Rock Island County Health Department for their hard work under these difficult conditions. We are tired emotionally, intellectually, and physically. All of us joined the public health workforce to make a difference in our community. While COVID has changed every aspect of our work and home lives, health department staff are still protecting all the public's health. I am very proud of our staff who continue to serve our WIC clients, help families get the resources they need to navigate these dark days, inspect restaurants, private water suppliers, and septic systems so we don't have foodborne outbreaks or unsafe drinking water on top of everything else. They educate about health and improve the health policies. We are still, of course, giving flu shots at clinics all over the county and by appointment. And we administer other vaccines to prevent disease and investigate other infectious disease outbreaks, which still occur even during a pandemic. We need your help. If you have the virus, you must stay home at least 10 days after symptoms start, even if someone from the health department has not told you this. If you have been told by anyone that you're a close contact to a sick person, you must stay home 14 days from the most recent contact you had with that person. Please don't go out in public and spread the virus to others. Please help us. Thank you.
Thank you, Ed and Nita. The information that they shared today on the holiday guidance is posted on the Scott County Health Department's website, as well as the togetherqc.com website, which is the shared site for the COVID response in the Quad Cities. Please, any of the media partners, if you do have any questions, type them into the chat. We do have a couple that we'll field now. Nita, the first one is for you. Please tell us about the December 4th and 5th testing site in Moline.
Yeah, so this is really great news. It is the Illinois Department of Public Health drive-through free testing site that we've had 4 or 5 times here in Rock Island County. We continue to request that resource at every opportunity, and they are coming back December 4th. I'm sorry, it's December 5th and 6th. It's the weekend of December 5th and 6th at the Tax Slayer Center in Moline, and that will be 8 a.m. to 4 p.m. this time. We are asking them to potentially stay for a longer amount of time, and we are working with the state on that. So hopefully we will hear more good news on that front soon, but definitely December 5th and 6th. That is the weekend. I'm sorry if I said that wrong. December 5th and 6th at Tax Slayer Center, 8 a.m. to 4 p.m. Thank you.
Ed, next question is for you. How many positive COVID cases were reported today in Scott County?
That number depends on what you're asking. You're asking about today, November 17th, since midnight to the current time, that number is 62. If you were talking about what we received, the information that we receive is different from that on coronavirus.iowa.gov. That's updated in real time. And it depends on what time of day you look at it. We receive a dump every day that constitutes the previous day's full number of cases. And this morning we received 106. Monday and Tuesday tend to be our lowest days, since that represents mostly Saturday and Sunday tests, and Test Iowa is not operating on the weekends.
Thank you. Ed and Nita, a question. What are your Thanksgiving plans? Perhaps you can share how you're putting these guidance into action.
Sure. For myself, I have 2 college-age children, so they will be home. I guess they're not children, they're adults. They will be home, and it's just the four of us, my husband and the young adult children. Normally we would have my in-laws, and normally we would have my sister, our extended family, and they are not coming over this year. We are just going to have a family dinner.
Okay. Next question here. We heard from both health departments about contact tracing today. How can community members help with the contact tracing process? Does it come down to answering when health department calls, or are you looking to hire more contact tracers? Ed, could you start with that question?
Yes, please answer the phone when you're called. We in Scott County are not looking to hire any more contact tracers because, as I noted during my part, we have relinquished primary responsibility for that to our Department of Public Health, but IDPH is putting out an RFP for contact tracers, and there are a number of commercial firms who look to hire contact tracers.
Sure, for Rock Island County, we are still doing contact tracing, and so the community can help by, again, answering the phone and helping us to figure out who the close contacts might be that are exposed to try to limit the spread of the virus, as well as, you know, because we have so many cases, to be patient with us, I guess, would be wonderful, and really to stay home. If you're told to stay home, please do so. Please try not to go out to the grocery store, other places. Try to opt for home delivery or curbside pickup or some other contactless way of getting the items you need. That would be great.
Ed, as a follow-up to that, can you describe, even if someone hasn't yet heard from a contact tracer, what should they start doing on their own if they know that they're positive?
If they know they're positive, they should stay home, isolate themselves from family in the house as well as possible. Just make sure that you don't do anything that would tend to give you a possibility of transmitting that disease to someone else.
Nita, do you have an indication of the phone numbers people should look for when they're coming from your county?
Yes, and I think we have those posted on our website and Facebook, and we'll post them again to be sure we get everyone. The main number is a 312 area code, so it does look like it's coming from Chicago, but it's a specific number that wouldn't be used for anything else. So we'll repost that, and any of the Rock Island County Health Department numbers will start with 558. So it'll be a 309 area code and beginning with 558. Those are our extensions of our contact tracers.
This is Janet really quick. I do have that Chicago number. It is 312-777-1999. And then in addition to what Nita said about the 558 numbers, we do have some Rock Island County cell phone numbers that starts with 737. And I will post this again to our Facebook page. Thank you.
And in Scott County, we do know that our phone numbers will come from a variety of numbers, just potentially if staff are calling from a county cell phone or a local number, but they do leave messages, not detailed in terms of what the matter is about, but it will ask the individual to contact the health department. Nita, another question. With Governor Reynolds' mitigations yesterday, that would be to both of you, and Governor Pritzker's mitigations today, how do you balance the differences for people traveling and back and forth from each state? I'm assuming this implies individuals who live in one of our counties and maybe work in the other.
I'll go first and then Ed can respond too, but I would just encourage anybody traveling back and forth to really pay attention. There are a few little differences between Iowa and Illinois, as there always are, but really strongly encourage everyone, whenever out in public, to wear a mask and socially distance themselves from everyone else around you.
Yes, I'd second that. Be aware of the differences between the states, but employ all the measures that we've entreated you to do, no matter which state you're in.
Okay, with no additional questions, we'll go ahead and conclude for today. This will be posted on our websites as well as social media pages, so please go there if you missed any information. Full details on case counts for Iowa can always be found on www.coronavirus.iowa.gov, and then you can click on Scott County on the map to get that information. Thank you all very much for joining us. We appreciate your support and sharing these important messages so we don't have holiday spikes as we've been seeing in the past. And we look forward to talking with you again later this week. Have a good afternoon.